My name is Dick Jackling. Or Richard is my given name. I was born in Minneapolis, Minnesota, and we moved to Seattle in February of 1954. I was diagnosed a month or two before June of '06, and I was treated on June of '06. My urologist, Dr. Pellman, reviewed the options available to me for treatment of my prostate cancer. And when I heard about the C treatment, and I had a couple of friends that already underwent this treatment, he referred me to the Prostate Institute. It was a surprise. I believe I even, after my biopsy, I questioned the accuracy of it. But no, it was a surprise. I can't say that I was really upset about this because a number of my friends had already been diagnosed, and it was just I guess part of my feeling of growing old. And my father had gone through the same procedure about the same age I was. Actually, my wife was a partner in our review of the options and in the final decision of what I was going to do. And I think that was the most difficult part because you don't really receive any professional direction other than the varying options. So we had to go through each one of these options because there are a number available. We went on the internet, and the University of Washington has a place where they review the options, and I did a lot of reading, and then I reviewed the options with friends. It was coincidental at the time that two of my friends were diagnosed at the same time as I had been diagnosed. Matter of fact, within a month of one another. And I had a fraternity brother who went through this treatment. And another one of my friends had surgery. So in addition to the published information, I also had firsthand information. The procedure wasn't really as bad as the biopsy. I think that it went pretty normal, and I was thinking about it in anticipation of coming here, and it was sort of a non-event at this stage of my life. We were told by our oncologist, Dr. Ulau, what to expect, and it seemed like everything that he explained to us went as normal. So, like I said, the C treatment was, or the actual procedure, I thought was very easy to have. My wife accompanied me to the office, and they did the usual prep, and of course I had an anesthetic, so I wasn't aware of what was going on at the time that the implants occurred. Both my oncologist and my urologist was present, and then when I came out of the anesthetic and after the recovery, I had to take it easy. My wife took me home, and it was explained that I was going to have I had to take care of myself. They gave you a little screen to urinate through so that if any of the seeds happened to pass, they wanted to make sure that they were returned. And but mine was rather an uneventful procedure. It went just fine. Well, probably the biggest side effect is one day my wife was my nurse, so to speak, and a day or two after the actual event, she said, "Boy, you're sure black and blue." Give me a mirror. I was black and blue. So as far as, and that's understandable with what they did. It really was not an inconvenient thing, and I was back to my normal activities. So I didn't have any side effects. So to gather the information and base your decision on what somebody else said, I don't think is a good idea. But it is a good idea to know what the experience of other people are. But your experience may be completely different. We're all different. We have different Gleason scores. The tumor can be in a different location. And so what one person's experience may be, another may be completely different. But I was very fortunate. Not only would I have recommended it. I've spoken to a number of people who were facing what I faced. I have another friend who had planned on having surgery. He lives in Yakima. And I know I'm fortunate to have a good oncologist in a group that specializes in this. Yakima may not be as fortunate, but as it turned out, there is an oncologist over there that was trained here. And when I told him about it and he went to check on it, he changed his whole process of treatment. And originally he was going to do robotic surgery, and he changed his mind and had the seed treatment. And to my knowledge, it's gone along fine. The Seattle Prostate Institute, especially my doctor, Dr. Ulau, is just a great guy. And my coming here and having him as my doctor has added to the support. I'm not saying this for the benefit of the camera or anything else. His assurance that I was a candidate in itself helped quite a bit, because I was not getting, people were reluctant, especially the physicians were reluctant to specifically advise you to accept one treatment over the other, as I said previously. But no, I have recommended the Seattle Prostate Institute as well as my doctor to a number of people. I believe in early detection, and I believe that it is a curable cancer. There's no reason for people not to receive a positive outlook from their treatment.